Stephanie Bell Flint joins us now to talk about preconception care. If you have questions, you can send them to the doctors at WLBT.com.
Thank you, Maggie. Joining us is Dr. Michael Livingston with Baptist for Women. Thank you so much for joining us.
Good to be here.
Preconception, you know, in the old days, nobody really thought about it, but it turns out that it's an important part of a healthy baby.
It is.
Tell us how.
Well, generally you don't even think about it, but patients in this state, for example, obesity, hypertension, diabetes is just prevalent, and so someone who's contemplating pregnancy really needs to lose weight if they're obese, get their blood pressure under control if they have high blood pressure, get their diabetes under control, because diabetes that's uncontrolled can really cause havoc early in pregnancy. It can cause miscarriages, stillborns, and so that's very critical.
Now, we've seen the research that says if a woman is thinking about getting pregnant, she should start taking folic acid. It's good for her, it's good for the baby. But how soon should preconception care begin? How soon should you be thinking about that if you're planning on getting pregnant?
That's a great question. If someone is contemplating pregnancy and let's say they are healthy with no issues of high blood pressure, diabetes, obesity, as soon as they stop their contraception, they need to be taking folic acid and prenatal vitamins, because the neural tube forms before they even aware that they're they're pregnant. And so the folic acid helps to protect the from neural tube defects. Now, someone who has hypertension, diabetes, they should, in my mind, be contemplating pregnancy and stay on their medications, on their hypertensive medications, and be losing weight, getting their blood pressure under control, their diabetes under control while they're still on their contraception, because, like I said, it's just critical to have that under control.
Well, the folic acid in recent years has really proven to work. I mean, they've fortified foods with it for starters,
yeah.
And women are taking it, and
yeah.
Neural tube defects and stuff have gone down, have they not?
They have. In fact, there's a birth control pill that has folic acid.
Really?
Believe it or not, yeah.
So you already got it in your system.
You already have it in your system, and that's the thinking behind it. Because when they stop taking their birth control pill, at least folic acid will be in their system, so it's very critical.
Well, what about lifestyle? What role does lifestyle play for a woman and her partner, her husband, who are trying to get pregnant, when you think about smoking, drinking, things of that nature?
Well, lifestyle plays a role if someone who's been trying to get pregnant, it's been a year and they haven't really gotten pregnant. Then they need to look and see how much drinking they're actually doing, how much smoking, if they are a smoker. But smoking can play a role in infertility. So they need to curtail that. But I have women coming in for annuals, for example, and pregnancy tests, they're positive. And they were unaware that they were pregnant, but yet they still maintain these lifestyles. So lifestyle does play a role when someone has been trying to get pregnant and they haven't.
So it's more so after the fact, though, those women, have they done damage when they get pregnant and they didn't know they were pregnant?
If they've been excessively drinking, they need to stop drinking, because alcohol has been shown to cause some detrimental effects in fetuses.
Wow. I watch this show occasionally called I Didn't Know I Was Pregnant. And it talks about women there.
I met somebody the other day who didn't know she was pregnant.
I mean, they talk about still having their cycles. They have just a small baby, but maybe, you know, they notice some little changes, but nothing major. How common is that?
That they still have their cycle and pregnant? Mm-hmm. Well, they're pregnant and it's bleeding in the first trimester. It's kind of common.
Wow. It's
kind of common, especially women who are anovulatory, not having monthly cycles, but yet they happen to have ovulated and gotten pregnant and unaware that they're pregnant, and they still have this dysfunctional bleeding. It's kind of common.
Well, I met a woman not too long ago who was 17 weeks.
Wow. I mean, and she had no idea.
No.
That's amazing to me, because I knew immediately. I got sick immediately, morning sickness, and I was as big as most women are at 6 months
really?
At conception. So So I knew immediately. So it's when I watch that show, it's amazing that many of them don't know until the baby is actually being born. They don't even know what the contractions are.
Yeah.
That's amazing.
It is. It is.
One thing they say that women who are going to get pregnant need to do is be vaccinated for the flu vaccine.
Mm-hmm.
And I know it's probably a certain point in pregnancy. At what point is it? And do you need other vaccines?
Well, after the first trimester, the flu vaccine is safe. And other vaccines, all the other vaccinations are safe except measles, mumps, and rubella. It's contraindicated in pregnancy because it's a live virus, but the other vaccinations are safe after the first trimester of pregnancy.
It'd probably be better to get those, though, before you get pregnant, right?
Yeah. Yeah.
I don't think so. All right. Well, Dr. Michael Livingston, thank you so much. And you're with OBGYN Associates, and that's over at Baptist, right?
Correct.
All right. Thank you so much. We appreciate you being here.
Thanks for having me.
And for the latest health news, you can log on to our website, WLBT.com, and click on Medical Matters.